First, to a report that came out today from the Menzies Research Centre, COVID-19 getting Australia safely back to work. We asked Henry Ergas, the economist, and his team to start looking at COVID-19 from the beginning of this crisis, with a key question in mind: how do we balance the economic costs and the health costs? I mean, clearly there was action to be taken to keep people safe on a public health grounds, but that was going to cost money. At what point, how do we balance that? His report, let me tell you, is very, very informative and revealing. The most important point, I think, to take out of this is that there is a cost-benefit curve we can look at. At the start of the crisis, the government was working under the assumption, based on the only reliable or the only clear information at the time, that there would be a death rate in Australia of up to 6,000 people per million. That translates to 150,000 deaths. Now, clearly at that stage, the benefits of preventing death was huge. If you could stop even a proportion of those people dying, the benefits would be huge, because with death rate, there also would come the demand on hospitals. We didn't want to swamp that, as we'd seen overseas. But over time, as you see on this schematic graph that we're putting up now, that the benefit from that declined. As we knew more about the disease, it became clear that it was less deadly than we thought, and we found better ways to control it. So instead of 6,000 deaths per million, which was the worst case scenario back in March, we actually now have about 4.2 deaths per million, and it's even lower in Victoria, at least at the moment. And by world standards, that's incredibly low. So we have done really well out of this, which I think gives us the opportunity to rebound well out of this. But of course, we've had complications. Henry Ergas joins me now from Canberra. Henry, welcome to Water Cooler Live.
Thank you.
Henry, can you explain to us why the benefits from the lockdown reduce over time? Why does that happen?
One reason the benefits have declined over time from the lockdown is that the constraints we faced at the outset, which were to do with hospital capacity and essentially the risk that the hospital system would, in a sense, be swamped by cases of COVID, that risk has diminished. And it's diminished really for a number of reasons. First reason is that thanks to the initiatives of Commonwealth and state governments, hospital system capacity has been greatly expanded, and particularly the capacity to deal with COVID-19 cases. At the same time, the measures that have been put in place, particularly in terms of quarantining and more generally restricting the flow into Australia of COVID cases, those measures have, with the exception of Victoria, proven reasonably effective. Obviously, there have been glitches, like the cruise ship issues in New South Wales and in the cases more recently in Victoria. But by and large, we now know that that can be controlled, and as a result, that means that our underlying infection rate is lower, and at the same time, we have better ways of detecting infections and treating them. And so all of that translates into a reduction in the risk of being overrun with fatalities, or overrun with cases which our system could not manage. At the same time, the longer these lockdowns continue, the greater the economic costs are. It's one thing to have a lockdown of a week, say. That's a bit like an extension of the summer holidays. To have a shutdown of months, obviously imposes huge hardship on many and undermines the economic fabric of society. And at the same time, the measures governments take so as to cushion those effects, in particular through transfers, such as other new forms of social welfare spending, such as the job keeper allowances, all of that has a budgetary cost. Those budgetary costs accumulate and leave a legacy that will weigh very heavily on recovery in the future. So on the one hand, we get declining benefits. On the other hand, we get increasing costs. And as the benefits decline and the costs rise, that makes it urgent to transition away from the type of strategy that was initially pursued.
You say it's urgent, Henry, to get out of the restrictions on economic activity. How do we do this? How quickly can we do it? Should we be opening up the borders right away? Should that be our first step?
I think the borders within Australia are, by and large, difficult to justify. I have some, not sympathy, but I can understand why there would be a certain degree of hesitation in respect of Victoria at the moment, since the Victorian government hasn't so far shown a great capacity to implement even the first stage restrictions which were imposed. But one has to recognize that the costs of these borders, of these internal borders, is very, very high. And obviously it's crippling in the case of border towns, be it in Queensland or in New South Wales on the border with Victoria. And so given that the costs are very great, you would have to have compelling evidence of very substantial benefits so as to keep them in place. And I don't think that evidence has been forthcoming. So that's clearly a step that's worth looking at.
It seems to me that we've, in public health issues before, for instance, we used to have a problem, enormous problem in this country with children drowning in swimming pools, in domestic swimming pools. We haven't gone for this blanket, close it all down. I mean, we didn't pass a law that said you can't have a swimming pool in your backyard because kids were drowning. Instead, we fenced in the pool. Could we go for more of that kind of strategy here, particularly in terms of, you know, the people we know are most at risk in the community? Could we particularly look after those and allow other people to get on with their jobs and occupations?
Yes, I think that's right. I mean, I think the strategy that has emerged as performing best almost everywhere is to protect the vulnerable, to ensure that you protect the vulnerable, which is exactly what you're saying. It's your fencing strategy, and that's obviously an issue that's especially acute with respect to aged care homes. Secondly, to promptly shut down hotspots, to identify and shut down hotspots. Third, to limit mass gatherings and ensure that mass gatherings aren't of the kind that we saw with the Black Lives Matter rallies and don't have those kinds of risks of transmission. And fourth and last, to identify and deal with, including through isolation, individual cases of infection. And so it's those four elements that really should be the pillars on which a successful strategy for dealing with COVID can be built. And that will need to be done one way or the other until either a vaccine is developed or we have consensus about effective cures.
So that means probably we would be we should be thinking about a strategy perhaps for the next 3 years. What happens if we don't get a vaccine? How do we live in this situation where the COVID-19 virus is still active?
Yes, that's right, because at this stage, we don't know how long it will take to develop an effective, safe vaccine, nor do we know how long it will take to have safe and effective and agreed upon antivirals. And so in the absence of both vaccines and antivirals, we do need to have measures to contain, limit the spread of COVID-19. And those measures I spoke about, I think, can do that pretty effectively. One unfortunate aspect, I would say, of the current situation is that we are investing huge resources in developing vaccines or also antivirals, but we're not really investing terribly much in understanding what works and what doesn't. Which of the measures that were implemented have been effective and which were not. When this whole situation began, clearly we were operating in the fog of war or the cloud of uncertainty, however you want to put it. And so at that point, there really wasn't time to undertake proper analysis, nor was there really the information base that would be required to do so. Now we're much further down the track. We have several months of experience. We have a great deal of experience internationally. It's important to do what we didn't do at the outset, which was to go through the kinds of regulation review processes that the government mandates for all other regulations. And that's one of our major recommendations in this report, to do what in the jargon of regulatory reform and regulatory review are called post-implementation reviews, to go back and say, well, what worked, what costs did it entail, and what benefits did it result in? And that would help us as we develop a strategy that I think we need to develop for looking at what we do over the next 3 years.
This week, after the Victorian outbreak, there have been people calling, saying, well, look, you know, the suppression strategy, or they call it, or mitigation, isn't working. So let's go for the full eradication. Let's have the mother of all lockdowns. Let's wrap people in cling film if we need to and put them in a corner, whatever it needs to do just to wipe this thing out altogether. Is that feasible?
I don't believe that's at all likely to be feasible unless we are willing to bear enormous costs. What it would require is that we effectively become the hermit kingdom and cut ourselves off from the rest of the world. And also, given that something will always slip in, that we adopt extreme measures that would impose unimaginable economic and social costs. So I think it's neither obviously feasible nor evidently desirable. And adding to it all, the reality is that even in highly authoritarian states, governments don't have the administrative capabilities that such a prolonged strategy of eradication would require. If the Victorian experience is anything to go by, Australian governments really don't have those capabilities. So we would both incur enormous costs and end up with demonstration that that strategy was futile. As I see it, those calls for eradication are just another symptom of the apocalyptic thinking that has gripped Australia for some years. The apocalyptic thinking which says every lump of coal is a step to Armageddon. Every COVID case heralds an uncontrollable pandemic. And so any attempt at mitigation must be set aside in favor of complete elimination of coal, complete elimination of emissions, complete elimination of COVID. Well, life is about trade-offs. It's not about complete choices one way or the other. And what that strategy really is the denial of trade-offs And hence, since democracy is essentially about both articulating and grappling with those trade-offs, it's ultimately an attempt to deny democracy itself.
Well, Henry, thank you very much for the report, which and the work you put in with it, and for the pleasure of working with you for the last few months on this. And I think, just to round off, at the beginning of this, I remember you urged us to think about 3 possible strategies. Do we have a strong lockdown? Do we not lock down our economy, as some other countries have done, like notably Sweden? Or do we, when we have the virus it starts to break out, do we lock down and then let go when it eases up, and then lock down again? And I recall that when we did the modelling on this, the stop-go strategy, as we called it, was the worst of all the cases.
Yes, it is, because the lock-go strategy is a war with intermittent truces in which you incur all the costs of war and none of the benefits of peace. And what you need, if we're to navigate this challenge like so many others, what you need is resoluteness without extremism, determination without fanaticism. And that's that sort of middle course that I think is very much in the spirit of the Menzies Research Center and of what the MRC stands for, and is really what we ought to be pursuing.
Thank you, Henry, and we look forward to revisiting this conversation on some future time on Water Cooler Live.
Thanks very much, Nick.